Homelessness affects approximately 565,000 Americans. The homeless die earlier than the general population, often from preventable or treatable causes. Healthcare providers must take steps to reduce barriers that prevent the homeless from receiving primary care. Barriers include lack of access, lack of trust, and the perception of stigmata among the homeless. To address lack of access to primary care, the provider can connect homeless patients with social services or county services so that they may gain health insurance through Medicaid or Medicare if they qualify. Then the provider must accept Medicaid because a significant lack of access is due to providers not accepting Medicaid patients. To increase trust, it is important that the homeless patient feels that they have been heard and their needs understood. If the primary care provider only focuses on the physical problems, the patient may feel they are not being heard and stop utilizing primary care. Have information readily available on local mental health organizations, substance addiction treatment options, supportive housing, shelters, and food shelters. To reduce the perception of stigmata, the primary care provider should create a welcoming environment without judgment. Also, understand that some homeless patients may be very uncomfortable, experience embarrassment, or even a sense of danger due to PTSD or social anxiety if forced to sit in waiting rooms for long periods of time. The homeless patient may be forced to frequently no-show appointments due to lack of transportation or other elements outside of their control. The provider may wish to take formal training to increase their understanding of providing care to this population. In addition, treatment of the homeless may need to be adjusted based on the individual's situation. The National Healthcare for the Homeless Council has developed guideline adaptations for treating a multitude of chronic diseases and can be easily accessed by primary care providers. Frequent follow-ups are encouraged to ensure that the patient is able to adhere to interventions and to establish a trusting primary care provider-patient relationship. This relationship development, trust, and understanding are key to providing primary care, preventative health care, and management of chronic disease in this underserved population.
Created using Powtoon.